What makes a place ours? Is it the people, the footprints on the sidewalk, the smooth road to the lake, the crushed path through the wheat? To learn to love a place is the same as wanting to grow with it, to continually reimagine all that it's capable of. Albertans know to dream the way dreams are meant to be, with each other. We innovate with bursting hearts and big, sky-wide ideas, because that's what it takes to make a future that inspires everything we will learn to love and build together. Alberta Innovates. It's what we do. Learn how.
Hello, everyone, and welcome to our second Learn How talk. This time, we are joined by our health team, who will be speaking about digital health in Alberta and the shift that is taking place. This is part of a larger Learn How initiative where we are looking to showcase all innovation across the province. So if you would like to get involved and perhaps be profiled, please visit learnhow.albertainnovates.ca. You don't need to be funded by Alberta Innovates to be profiled, but please take a look over at our site and reach out to get involved. So with me today is my co-host of Shift by Alberta Innovates, John Hagan, and we are joined by the health team. So we've got Sean DeWitt, Senior Business Partner, Sunil Rajput, Senior Business Partner, Sandra Stabel, another Senior Business Partner, and Tammy Mah-Fraser, our Executive Director. Welcome, everyone. How are you?
Doing well.
Very good, thank you.
Awesome.
Excellent.
So
it's nice to see everybody today.
Yeah, let's kick it off. I want to know, what the heck is digital health? What does that mean? What does it mean to you? And I'm going to start with Sandra. Sandra, tell us about digital health.
That's a loaded question, Katie.
No pressure.
Everyone defines it differently. But there's a shift happening. Groups like the FDA, Health Canada, all have a different definition. Personally, to me, it's a shift towards digitally enabled, data-informed healthcare system for the patient and the consumer. So it's a shift from systems thinking to the patient and the consumer is the bottom line, even though there's all sorts of other technical jargon used.
Okay. I'd like to jump in. So just stemming off Sandra's point. So I also think it's a revolutionary shift of applying computers and computer networks to healthcare delivery. And so, as Sandra said, it's more about putting the patient or the citizen in focus. And so that I think is what digital health is about. It's from when it started about putting computers into healthcare. Now it's about society being steeped and immersed in computers and digital technology, and how can we start leveraging those pieces to enhance our healthcare.
Well, an expression I heard that I really quite liked was the democratization of healthcare. Now, Sean, I believe I'd heard you say that. Do you want to flesh that out a little bit for us?
Sure. Yeah. Thanks. Hi, everyone. I think when we talk about that term, really, it's exactly what Sunil and Sandra have touched on. Is it's patient-centered, but for example, it's patients being in control of their chronic conditions, for example, and being able to self-manage better. It's having access to their own data. It's having access to their care teams when and where and how they need them. And I think that's, Sunil talked about a revolutionary shift. That's exactly it. And you're seeing patients being now at the center of health innovation, as opposed to just the subject of health innovation. And I think that's a big change.
Right.
So we're seeing that it's really, sorry, go ahead, Sunil.
Katie, I just want to actually put an example in here just to help the audience understand what digital health is all about and how we've evolved. So the example I have is the most commonly used biological measurement, which is glucose testing for diabetics. So in the past, a patient might go to a clinic and get tested, and then the doctor would test their blood sugar level to determine how much insulin they would need, or vice versa, the doctor would go to the house. Now you can go and buy a small device. The patient can do a pin prick. It is invasive. There is blood that's drawn, and then they would have to dose themselves. So it's a single time point measurement. So let's go into the future where possibly you have a contact lens that you can put on, and it has a little device in there, and then continuously measures how much glucose you have, and then reads it out to your phone, and now you have a measurement tool that's actually tracking how much glucose you have. Then you can take it to the doctor and say, okay, well, this is how much what my blood sugar is over multiple periods of time, and it's now non-invasive. You don't need to draw any blood. And then fast forward that, let's say if it's integrated in with Google Home or Alexa at home, and it's now starting to work with you as the patient to try to determine, well, what's your optimal glucose level. Maybe if there's an emergency, it can also dial 911 as well in case you forget to take your insulin, or you take too much insulin. So that's an evolutionary change from the past to where the patient or the citizen is more empowered to take control of their own health care, their own health system, and they're part of the solution as well to enhance their overall well-being.
That sounds
Sunil,
like something out of the Jetsons. Like that's really, really revolutionary. You're right. It is future facing.
I think Tam,
I want to take it down just to the basic elements. So when I think about digital health, I think about two things. I think about data, information, and I think about technology. And when I think about data, I think about essentially not just your lab tests or essentially the time that you gone to the doctor's visits, but I also tend to think about your non-clinical data, thinking about essentially what's the environment you live in, what sort of things, the genetics that you have, what sorts of things that your nutrition, what's your diet sort of thing, right? And, just building on an example where Sunil had, what they did was essentially, if you remember my mom used to actually monitor my dad's high blood pressure by, going to the store, buying one of those machines, and then daily she would write it down on a book, and then she would go in, when they went to visit the doctor, she would essentially show the list of high blood pressure testings over a period of time. And there was a study that was done actually recently in the US where they actually took a high blood pressure monitor. They actually applied artificial intelligence to it. And what they did was, based on the measures that they had, they were actually able to personalize coaching by nutrition, looking at essentially education around it. And what happened is that this feedback mechanism actually reduced high blood pressure in terms of individuals. It also actually linked data directly to the physician's office so they could monitor remotely. In a time of COVID, I think a lot of people are looking for these opportunities, not to necessarily go into the hospital setting, but what can I do in my own home setting to actually manage my care? And I think that's where the problem comes into, is the fact is that we're more seeking with the internet and information coming towards us. How can we get more, closer to real time, getting that information and valuable information that we need to essentially manage our care?
Now, that's all. Those are great points. But what really comes to mind for me is this all presupposes the access to technology and the access to the internet and all that. How do we make sure that as we're pivoting to digital healthcare, that people aren't slipping through the cracks?
And being left behind. Yeah.
Yeah. And I know that's beyond perhaps your purview, but I know that you guys are thinking about stuff like that.
And actually, it's not beyond our purview. So one of the things that the programs that we're developing here at Alberta Innovates is something called the ethics of innovation. So the ethics of innovation actually looks to see whether or not, are we actually fragmenting a population? So exactly as you're saying, John, is it that we're introducing technology that may not be available to individuals in some of the remote areas? That it's important to have that. So it's important as we're starting to develop these technologies, not just to think about the technology and perhaps, what you want to achieve, but to also think about the patient or the citizen who's using it. And when the environment that they're using in, the, some people, in terms of seniors, some seniors are very savvy in terms of technology. Some seniors are just, they just haven't, they're just not there yet, right? And so when we think about development of products or devices or things like that, we need to think about the people who are going to be using? Who's our target audience? And how can we best make sure that we're not actually biasing information, that we're not actually, creating vulnerabilities or creating disparity, right? We don't want to see a disparity in our population.
I'm so excited to hear about that. Go ahead, Sandra.
It also okay. Go ahead.
No, Sandra, go. Sandra, go.
I was
Sandra,
just going to say it stands to help reduce inequity in some ways.
Right.
COVID has actually introduced a greater internet access in a lot of areas, even in our province. There's a big federal push towards improving access to internet and high-speed internet in particular. And in some communities, all of this push towards digitally enabled solutions actually allows access that they otherwise wouldn't have. There's populations in Northern Alberta, Indigenous communities that have to drive a couple days to come to Edmonton to stay in a hotel to see a specialist for 10 minutes. When now, as of 6 months ago, with some of the shifts happening, those appointments can be done virtually without disruption. And so I think equity needs to be at the forefront of development, to Tammy's point, but at the same time, it's also helping to reduce the inequity.
Mm-hmm. It's a fascinating point that we're seeing that integration and cooperation amongst different organizations to facilitate these sorts of things. That's kind of the silver lining behind COVID, I suppose. Sunil, go ahead.
So I just wanted to touch on your point about the equity access and thinking about digital. So I agree with Tammy and Sandra just in terms of digital being more wider access, perhaps more faster access. But the equity piece is it's very the technology has advanced so far that your iPhone or your smartphone that most people carry now is very powerful in terms of its capabilities and its functionalities. So there are microloans in resource limited settings to provide these types of phones, and the phones are now going much more beyond just the purpose of calling somebody. It's used primarily for texting, video conferencing. There's a lot of functionality in just that little handheld device that you have that most people carry now, all the way down to younger. It's getting down to younger and younger demographics. So it is widening to be more inclusive.
Right.
So this has brought up a really interesting thought in my head. So access to technology is one piece of this puzzle, but creating the technology, do we have the capability in province to do this? Are we, I know that, we have Amy and we have other machine learning institutes. Is Alberta, do we stand a chance in marketing this and making this economical? Sean, I see you laughing and smiling. So why don't you take this on?
Yeah, sure. Thanks. Well, I think you've hit on something that maybe has been a sore point in this province for many decades, right? Which is historically world-class research, world-class discovery, and maybe what we can call sub-world-class commercialization at a provincial level. That is to say, we're able to innovate and we're able to create great things, but oftentimes we as a province did not reap the commercial rewards of that world-class research. And I think now what you're seeing, and I think what Alberta Innovates is trying to support with a lot of our new programming with the Health Innovation Group, is exactly that, is taking these great innovations, these great discoveries, research, and bringing them through the commercialization pathway all the way to market. We have brilliant people in the province. We've got all sorts of resources. I mean, I think we are a province of entrepreneurs, but in the knowledge economy, I think historically that might have been lacking. But now I think what you're seeing is the coalescing of a lot of key ingredients into the health innovation ecosystem. And I'm very confident and very excited about the capabilities that are there today and to see what tomorrow brings as well. Sandra,
you look like you want to jump in.
No, I think just to build on what Sean said, I think there's definitely a ton of opportunity. Sorry, my colleague just walked by and said he couldn't get into with you had like a piece of paper with a Sharpie written, I can't get into the event. And I'm like, what do you want me to do right now?
That's why this is a live event. This is a live event.
That's right.
But maybe I'll come back.
Live.
I'll come back to Sean's point. So I agree with Sean that I think we have all the ingredients here in Alberta. We have extremely strong, world-class researchers here in the province. As Sean said, we have several entrepreneurs here. We have a lot of investment here. It's now coordinating those pieces, and I would like to think that Alberta Innovates is playing a strong partnership role in terms of what we do to try to connect these individuals, try to bring these technologies to market as a collaborator. So we provide multidisciplinary expertise, market intelligence. We provide broad connections just as a house, and we provide funding. So we go much more beyond our role as a funder and as an applied research center. We try to go beyond that and work with our stakeholders, because we are Albertans as well, and so we're acting on that accord in a very mindful and responsible manner.
Right. So it's also
to take it a step back, though. I just want to point out the fact that it's not. This isn't an Alberta shift. This is a global shift. The shift towards digital health is a global shift, and no one really knows how to do it right. Like, everyone is struggling and everyone is innovating and trying to figure out, what creates the optimal ecosystem. And so the fact that we're even thinking about this here, the fact that our government is investing in this puts us just strides ahead. We're already fourth in the world when it comes to digital health innovation as Canadians, but the province of Alberta is incredibly well situated in this.
I didn't know that we were fourth in the world. That's really impressive.
In the space of digital health. And actually, touching on Sandra's point, so in 2019, the World Health Organization released their first evidence-based guidelines for digital health, and they have 9 recommendations in there for using mobile devices or mobile phones. And so that's the first ever world stage guidelines that's for digital health. So to Sandra's point, this is a global effort, and this is to help governments around the world to start investing and having that dialogue around digital health.
Well, something that makes me think about a global effort, and Tammy, I think this will be kind of your area of expertise, as we think about clinical trials. Clinical trials happen across the globe. It doesn't just happen in an isolated environment in one lab. It's spread out so they can get a diverse population. How does digital health, how will that play into like the Alberta Clinical Research Consortium's role with Alberta Innovates to push Alberta up in terms of being appealing as a clinical trials destination?
Very good question, John. So we learned a lot essentially during this pandemic. I think essentially it had accelerated in terms of how we look at trials and different designs. It actually forced us to actually look at away from the traditional coming into the healthcare setting, visits happening virtually, right? It also enables us to look at essentially other expertise that we need as we start to think about virtual health, because it's not your typical types of trials. Your trials are changing. The methodology is changing as a result of being able to do it. So in other words, what am I saying through all of this is the fact is that the wealth of data that we're getting in, we're actually able right now to start to look at the information that's coming out of ConnectCare, which is the electronic medical record system out of Alberta Health Services, get that patient sort of data, combine it with, look at some of the outcomes in terms of some of the interventions, and start to almost actually, before doing a study, start to look at where and narrow down where we should be focusing. So these are sort of things where it's not just essentially this is a good research question and we should do a trial. We're now actually leveraging the data that we have been collecting within the province, and we are very a data-rich province, to actually then to start to do trials differently or research studies differently. So the Alberta Clinical Research Consortium is working with the institutions and the healthcare systems in terms of looking at, what do we need to look at in terms of training our future workforce of tomorrow, right? The other thing that we're really interested in is that when we talk about digital health and we talked about self-managed, that happens in the community. We're interested in terms of how can we connect these companies essentially with your community-based physician, your primary care physician, you see, essentially with your, you visiting them, right? How can we take it, how can we actually make it more accessible for you to participate in these types of trials and studies? So I think that digital health expands a whole wealth of things in front of us. And these are just some examples in terms of what we're focusing on.
That's fascinating. Thank you.
So I want to talk a little bit about our healthcare system. So we have the capability in this province to develop this technology. We have the drive and the want from our consumers to have this technology. But where is our healthcare system in this? Are they ready for this adoption? Is this something that they're looking to include in hospitals and clinics? Where are we at on that? Who wants to tackle this?
Sean.
Sean, take it away.
Sure, I'll start, and then I think Sandra can also speak about some specifics with a program that she has that involves health system partners and exactly how they adopt new innovations. But I would say that broadly in Alberta, there's a recognition that this is happening, regardless of whether people are planning for it or whether it was part of their business plans or what have you. This is very much here. A patient today can get a telehealth app and speak to a physician immediately. So these sorts of technologies are here whether we're ready or not. So I think the health system, I would say our health system partners, and of course that's Alberta Health Services, but primary care networks, allied health, the pharmacies, the health system is of course bigger than just hospitals. So when we talk about the health system writ large, I think there is a recognition that, to Sandra's point, this is where things are headed globally. And it's moving in that direction. And so I would say that there is not only the recognition, but the willingness to take some of these things on. That alone, though, is not enough. We often speak with innovators about who have great technologies. And one of the first questions we ask is what their conversations have been like with clinicians and end users. How is this going to fit into care? Is this going to be wedged into a workflow that's already crammed to the gills? Is there capacity for it? All those sorts of considerations are, that's more than just notional and more than just conceptual. It's a very real and tangible problem that I think our health system partners are ready to tackle, but we need our innovators to align with that as well. But Sandra, your program tackles some of that.
Yeah, I can get to that right away here, but to build on that, I think the difficulty is that in a digital health ecosystem, you need those that have the ideas and the capabilities to develop the technology, but you also need the end users. And right now, the end users and the way our kind of health delivery systems are set up, they don't have the mandate to innovate. They don't have the space to innovate. Their mandate is direct patient care. And you talk to any family doctor in the day, they don't have time to be fiddling with a new app or to try to figure out how to fit that into the workflow. They don't get remunerated for that. It's not incentivized in any way. And so I think there's definitely a gap there. And there are efforts being made to try to build that capacity and start to shift that culture. There's some attempts at changes in remuneration from a policy perspective. At Alberta Innovates, what we're trying to do, that's a bit of a stopgap. We recently launched a new program called implementalberta.digital health. And the whole purpose of that program is to give health delivery agencies or organizations this space to innovate. And so if they have a problem, so this is a pull innovation, they have a problem they need to solve and they think a technology could solve it, they can go out and find a technology provider that could be Alberta based or it could be from anywhere as long as the health delivery organization is Alberta based, and we will help support a project to test the economic viability and the clinical efficacy of implementing this technology. And so the technology needs to be fully commercially available. It's not necessarily a tech development play. It's about building the capacity for the system to start adopting these technologies and start to shift that culture.
That's so cool.
Yeah.
Yeah, that's really wonderful. Are we working, I would assume, across boundaries within Alberta Innovates, with entrepreneurial investments? Are we working with the technology development advisors to potentially identify some of our existing businesses or clients to help address those issues? Sandra.
All the time. Yeah. Definitely. So at Alberta Innovates, we have three main verticals. Okay, we have clean resources, health, and entrepreneurial investment. And as much as we can, when we can, we try to collaborate. Entrepreneurial investments are focused on entrepreneurs in general and sector agnostic. And so within their work, they do a ton of work with health companies. And they often are picking up the phone and calling us and saying, hey, what about these guys? What do you think of these guys? Can you talk to this client? Do you think this client would be appropriate for your programs? And we're always happy to see that handover. Had a conversation with a company this morning that came from PD in Calgary. So on the other side, the clean resources side, we're starting to see some areas of interaction with that group too. As we start implementing all of these technologies, there's definitely an environmental impact to that. Right, like you start, when you have all these high-powered computers assessing this data, and some of these technologies that we're putting into place to keep our citizens healthy during COVID in our buildings, there's a huge environmental impact, and so we're actually working with Clean Resources right now to examine what the opportunities might be there between health technology and a greener planet.
Sure. Yeah, Sunil, just one moment. I think we'd be remiss if we didn't mention that post-secondary investments plays a role as well as they move researchers and entrepreneurs and helping to identify those problems and potential solutions. So Sunil, go ahead. And then I think after, let's take some questions because we're starting to get a few coming up, and I want to make sure that our audience is heard as well.
I just like to give a plug to the other side of the house as well, the Innotech Alberta and C4 Technologies, which is our applied research arms of Alberta Innovates. And so they're very industry focused, and so they support industry in terms of just adding on to whatever capabilities that they don't have. And so there is that feedback that comes back to Alberta Innovates as well. And also likewise, we pass information to them, anything that's related for industry support. So I just want to give a plug for that side of the house.
I like that. That plug for that side of the house. Yeah. So let's. I just want to take a question here. I'm not vetting them, so to speak. So I'll just ask it as I read it, and if we're capable of answering it, great. If we can, provide some sort of insight, excellent. So this is from Sundar Manku. Does Alberta Innovation, I'm assuming Alberta Innovates, interact and support digital healthcare startups from other provinces? Our startup increases accessibility to local pharmacies, and we're looking to take it outside of Ontario. Is there a link you would suggest or a contact you could suggest?
Yeah, so I would actually sort of any door is the right door. You can drop any of us a line, and we're happy to find the right program. The short answer is yes, in the right context. So, Sandra had mentioned for her program that a healthcare provider in Alberta can use a digital health company based anywhere. So there's an example there. And we also have some other programs where, maybe it's an out-of-province testing site. The criteria would vary by program. The short answer is yes, although of course the focus is on Alberta-based companies. There are setups that might work. So I'd recommend dropping us a line and then we can have the conversation.
Okay, thank you for that. So Sundar, drop us a line, go to the website, albertainnovates.ca, and look for one of these wonderful people.
Another question here, and we've discussed this a little bit with our health data, our Alberta Data Institute, and it was on ownership of data. And so Brent is asking, data is owned by the individual in the UK, yet in other locations here, it is not held by the individual. Might this change? And to add on to that, what are we going to do about that? Data ownership is such an issue here. And if we're implementing digital health, what are we working on, and how can we help? Sandra.
Well, our Health Information Act is incredibly outdated in this province, and I have heard rumors that there is some work being done in that, and I think that's one of those kind of policy implications that might help. Data custodians in this province it's super convoluted and complicated. Our data sits in as an individual. Our data sits in many different places. It's super safe, very, very, very safe. But it's in a lot of different places, which makes it very difficult to use and very difficult to make data-informed decisions. And so there's a few different things that I think need to happen. I think there needs to be some policy changes and also some work in trying to get organizations to safely start to use different data sets and bring them together, right? So we have like our health service delivery data, there's billings data, there's all sorts of lab data that exists in the province. And then Tammy earlier alluded to social determinants of health. Well, all of that data only informs about like 15 to 20% of our health outcomes. The rest is our education, our maybe interactions with the judicial system, what food we eat. There's all these other things that impact our health, and that data also lives in other places. And so ultimately, like, where we want this to go is that the individual owns their own data, because they're the only ones that will ever keep it straight. And if you own your own data, then you become an empowered consumer, and hopefully a more empowered and healthy human if you can make better health decisions, right? That's
a wonderful way of putting it. Owning your data, you become a more empowered citizen. So yeah, I love that. Now, we alluded a little bit to your program, Sandra. Sean, Sunil, Tammy, let's go in turn and just talk a little bit about your programs and the digital health implications of those. So Sean, do you want to start? Take us down that path?
Yeah, sure. So I'll also speak on behalf of my colleague Graham Anderson, but we at Alberta Innovates on the Health Innovation team have a whole suite of programs that are designed to essentially cover the entire innovation journey, all the way from I'm generating ideas to I am now the standard of care. Sandra's program, Implement, that she mentioned, is at, I would say, the end of that cycle, right? So she's talking about fully commercialized products. But the question earlier about technology commercialization, we do have programs to essentially cover that entire commercialization journey. If Implement is at the end, we have, if you can imagine backing up a little bit in reverse order, there's accelerating innovations into care, market access. And that program is to help companies generate real world evidence, at a clinical site and get that evidence binder that helps them go to the next customer and get into the market. That program, I would say, is extremely helpful, and it's win-win. The clinical site gets to adopt an innovation and in a de-risked way. And again, the innovator gets to have their evidence that they can go and get more customers and with. A little bit before that, of course, before you're trying something in the real world, you have to validate what you have. And this is often a valley of death for innovators. There's not a lot of funding out there for these activities. And so we have Accelerating Innovations into Care, Validate. And that program funds not just the technology development, but the holistic development of the entire company to be able to get to a place of real world implementation. So we can fund regulatory work, we can fund intellectual property work, technology development, all those things that have to go along with just pure technology development, we can fund. And that, building a bridge across that valley of death, I think is something that, at least from the feedback we've heard, is really important. And
sure. Yep.
backing up one more step, I would pass it over to Sunil for a program that leads into ACE Validate.
Oh, thanks, Sean. So as we're going in reverse order from the market, so think of it from the market. So Sandra's program implement.digh is the closest to the market and health system transformation, and then I'm on the very upstream at the starting point called ACE concepts. So this is accelerating innovations into care concepts, and this is exactly for early stage innovators. So they have an idea and they want to now demonstrate proof of concept. So that's essentially the early stage development of that. And the first stream that we have in this particular program is all around precision health or personalized health. And we have three major areas within this this particular field. This is around disease prevention, diagnostics, and personalized therapeutics, ultimately to optimize clinical decisions and maximize health benefits. So that's the early part of that commercialization journey, where we have ACE concepts. That's where that program sits, and then it feeds into ACE Validate, and then ACE Market Access, and then implement.digh.
So I know there's another. Oh, sorry, John.
I just wanted you to clarify the acronym again one more time for us.
Sure.
ACE.
ACE. So it's accelerating innovations into care.
Okay, thank you.
I know that there's another program here with a colleague that you guys are working on called the HIP program, and I would like to take this opportunity for one of you to talk about that, because I know there's a lot of potential in what we're discussing through this program. Sandra, do you want to take this one?
I can take that one, yeah. So the HIP program was just launched like a couple weeks ago.
What does HIP stand for before we begin? Sorry.
Cool, or
Yeah.
like being really awesome.
Oh, go on,
Not
Sandra.
me.
No, it's health innovation partnership platform, or platform partnership.
Platform partnership.
Yeah. Thank you, Sean. Yeah. Platform partnership. And so that this whole spectrum that Sunil and Sean were alluding to, this whole client journey, innovation journey that we talk about, this program spans the entire journey. And basically this program is the acknowledgement that we cannot uplift the health innovation ecosystem alone. There are lots of organizations in this province that are doing excellent work, and we want to enable them to be able to do more of that work. And so what we're doing is we're putting quite a generic call out, trying to get organizations to stand up and say, hey, we know there's a gap in this area of the innovation spectrum. We want to do something about it. We want to implement a program. And so the registration deadline, if you feel like you have an idea for this, and we're looking for like backbone organizations. So not necessarily like single companies. We're looking for large backbone organizations that can implement large scale programs that will then support a bunch of innovators. And so the deadline for registration is November 30th. So registration just means you put your company name in our system. Once you're registered, the kind of first cutoff will be, or the first application cutoff will be January 15th. At that stage, we're going to decide which opportunities we want to pursue further. And those organizations will get $200,000 over 9 months to collaboratively further develop the concept of their platform. And so they'll develop it. And then at the end of that kind of 9 months, then we'll decide which programs we want to fund more long-term, likely over 3 years, multi-million-dollar investments we're talking here.
Now, Sandra, where would people go for more information on that?
On our website, albertainnovates.ca. The best thing to do is use the search engine and just put platforms, and it comes up.
Okay. Now, Sunil, you go ahead.
I just want to clarify the registration piece, because for the ACE Concepts program, we also have the same registration requirement. And so the registration deadline for ACE Concepts is December 7th. But the idea is that to go in and put in your title and put in the abstract. So you have to save a draft in our application portal, Alberta Innovates application portal. You need to go in and save a draft. That's the key piece to save yourself as a registrant. It is separate as creating an account.
All of this information is on our website.
Yeah,
if you go albertainnovates.ca, again, if you use the search engine, you'll have an easier time finding. So any of the ACEs, just search ACE, AICE. You'll find concepts, validates, and market access. Implementalberta.jj, you can search implements, so ACE, implements, and platforms. And you should be able to find the information. There's a lot of information on our website.
Now that's a perfect segue to platforms, because our colleague Tammy is health platforms.
Absolutely.
So Tammy, take it away.
Oh, so you imagine you have a company and probably a small startup company, and we talk a lot here about, in terms of your end user. We talk a lot in terms of, just the example of who owns the data, or, how do I even start to validate my product, right? This is where health platforms comes in. So we have a suite of programs essentially that has expertise that researchers, as small, medium enterprise companies can actually then access, right? So one of the ones is we talked about earlier about the ethics, right? So, everybody believes that, and everybody's ethical, that I wouldn't do something unethical, right? But sometimes what happens is depending upon where our data comes from, we actually may be introducing biases into that. So one of the things that we're doing is we're helping companies through independent review just kind of look at essentially of what is your data? What's coming out of the black box? Is that transparent? Is that explainable? These principles, we're helping kind of companies kind of build that in to build consumer trust, right? And I think, as we talked about earlier about who owns the data, privacy, security, who has access to it, who is, when does that, does information come back to me? These are all really, really good questions to have. And it's really good as you're developing it to think about these things of who is your end user, and we can help you with that. The other sorts of things that we're also interested in is at the core of all this technology is the patient or the citizen, right? We're doing this essentially for individuals. And oftentimes what happens is that when we're developing it, what gets lost is essentially the consumer voice, right? So sometimes technology gets developed and it actually, as wonderful as the technology is, because we haven't necessarily considered on how the individual is going to be utilizing it, it just doesn't, it's not as functional, it's not as usable, right? And so what happens is through SPORE, you can actually access a number of services, and SPORE looks at increasing the quantity quality of patient-oriented research. SPORE is a national CIHR funded program co-funded by, Alberta Innovates. And what happens is that through that program, not only can, you look at individuals to participate in your study, but also patients want a greater voice. So they want to contribute in terms of being on committees where you're having these discussions, or they want to look at helping you in design, so that what comes out of it actually is something that's going to be relevant and useful to patients. So, go to SPORE, because there's a number of things in terms of, even if you're looking to access data from Alberta Health Services, there's a link you can go in there. They can help you with your methodology. They can help you with your knowledge translation. There's a number of services that are available on Alberta SPORE support unit.
And where do people get more information about that?
So it's absporu.ca.
And SPORE stands for what again?
Alberta SPORE Support Unit. So Alberta Strategy for Patient-Oriented Research.
Which actually is really convenient, Tammy, because there was a question just asked, does Alberta Innovates partner with AbSpore on innovation initiatives? The answer is yes.
And yes, we do. Yes, absolutely. So this is something that's available to, as I said, to researchers or to entrepreneurs to access into the services. Yeah, then we do partner on that. And we're actually entering into the next phase of it, where Alberta Innovates will also be a key funder of that as well.
Excellent.
Perfect. Thanks, Tammy.
Let me just finish off with one last program, if I may.
Yeah.
And the other one we talked about earlier is really that that community kind of component to it, right? So we talk about essentially moving it like into your local setting. So we talk about care at home, and I think care at home is really trying to understand of, like, as I say, I actually don't go into the healthcare system unless it's a meeting. Most of my care is actually done by my primary care physician. And we want to look at opportunities essentially for individuals such as myself who don't have a lot of complex issues to be able to participate in studies in different ways. So, There's Be the Cure website where people can find out for different types of studies that are available. But then on the other side, we're interested in working with, as I said, the community physicians. How can we work with community physicians, help them get set up, and help them be available and accessible essentially for companies to actually test their products in there? So, some of the work the Alberta Clinical Research Consortium is doing is that, we talk a lot about clinical trials, and you'd be saying, oh my goodness, where do I start? Where do I go? Like, this is just a lot of acronyms you have going on here. Last 5 minutes, like, help me through this. We actually have a concierge service where you actually can get hold of us. We'll help you kind of navigate through the system, and we'll help you in terms of your pathway and get you directed to the appropriate parties.
Very nice. Thank you. That's convenient. Let's get to some of these questions here. I'm going to try to post some of the links. People are asking for us to post links, so I'll do that. Katie, perhaps you could have a look at some of those questions and pass them along to the gang.
So I'm going to scroll up because there's that many questions here. But I think I'll direct this first one to Sandra. So Michael is asking, so does precision health include regenerative medicine?
Oh, that's Sunil's question. That's not mine.
Oh, so that
over to you.
Sunil.
Regenerative medicine. Possibly. I would say I would have to learn a little more about the details of that project. But if it has anything to do with individual care or individual approach, then that would possibly be a fit. So I would encourage the person who asked the question to get in contact with me, and I'm happy to explore the conversation with them.
Great. This next question is really complicated. I'm going to read it, and you guys can, take it as you will. Brent asks, wearable has the potential to explode the volume of data and change the flow of care. Are you looking holistically? So in brackets, he says, historic is patient to concern to doctor's appointment to test, to result from the lab to action. Does that make sense to anybody? And can someone answer it? Sean, you're nodding.
I can try. The short answer is yes, we are trying to look at this holistically. So, anytime we talk to an innovator, for example, if an innovator comes to us, and we've had a few with any sort of wearable tech, again, we look at it. Yes, the technology is important, but again, the care pathway is important. Reimbursement is important. What's the plan for data? That is important. What is the clinical decision process, and how is that being incorporated? We do not look at technology in a vacuum, and frankly, it is just one piece of how we assess projects and companies and innovators. And frankly, if it's standalone technology without any of those considerations, we're a lot less, I would say, eager to get involved, because without those things, there's a risk, and commercialization requires all of those considerations. So that's my long-winded way of saying, yes, we look at it holistically.
Sunil, go ahead.
Just want to add to Sean's excellent answer there. So I think we certainly do look at it holistically. The first thing, all of our programs, I think, are bookended by what's the problem or the need that's being assessed or addressed, and then what's the expected outcomes or the goals. And so it doesn't matter what the technology is. It's just what is the problem and where do you want it to go and who is it going to impact.
Excellent.
Thank you. There's a question from Ankur Pandit. He says there's no separate stream for COVID-related health tech, is there? Could someone apply for a COVID-related project under ACE Concept or ACE Validate?
So again, the short answer is that actually we would take and invite anyone with a COVID-related project ad hoc, and just drop us a line if you've got a COVID-related project. ACE Market Access and even ACE Validate, those are 2-year programs, and frankly, for COVID, I think innovators are looking to move quicker than that. So we would deal with that ad hoc. As for concepts, Sunil, I'll defer to you.
Yeah, absolutely. Just echoing Sean's point, we would accept again, it's what's the need that's being addressed, and what's the expected outcomes. And also, just expanding on the question, there has been over the summer a lot of response from Alberta Innovates to COVID and COVID related initiatives. So please have a look on albertainnovates.ca. You will see a list of all the different projects that were supported, and the different researchers that are supporting the level of investment that Alberta is contributing to respond to COVID.
Thank you, Sunil. Yeah, I just posted a link to that in the chat there for everybody. So have a look at that as Sunil has suggested. Excellent.
Well, I'm going to just give it one more minute for some additional questions, but then I think we'll wrap it up here quickly. Before we do, I just want to remind everyone to visit learnhow.albertainnovates.ca to get more involved. We'd love to hear about your innovation and the work that you're doing to better our province.
I just wanted to add quickly here, Michael Kalos, who you'd taken a question from earlier, we were talking about AHS not having necessarily the opportunity, or doctors having the opportunity to innovate. AHS, he says, AHS SCNs have a mandate to change, innovate, and puts a question mark. So I suspect he's putting that out there as they may.
Yeah, no, I mean, that's a really good point. I think I was thinking of the health system more holistically, and in particular, like we've talked a lot about primary care physicians and physicians in the community, and you talk about like frontline clinicians. So SCNs have a mandate to innovate. They're doing excellent work, and they work collaboratively with clinicians. But sometimes it's really hard to get the frontline workers enough space to do this work, and that's even, I would say, even Alberta Health Services struggles with that, right? Like even though they have a group that focuses on this, even they struggle to kind of push that in, because ultimately it's at the cost of something else, right?
Sure. Yep.
And so they're always trying to balance.
Yeah, totally. Michael's responded, Sandra, I totally agree. One more question here from Wade B. Would Alberta Innovates be one partner along the innovation development spectrum if you're looking at building a center of excellence? Is that?
Maybe I can take a stab. I don't see that as one partner. I think you have it. The team players that come in, it's about the problem and what the need is, and then the appropriate expertise or the appropriate partners would come into play to help address all of that. Because I don't think one person has all the answers and has all the expertise. It's that diversity of ideas, diversity of expertise that come together to bring out the full solution.
So I think.
Go ahead, Tammy. I heard it actually. I was talking to a colleague this morning, and it's interesting. It was like, just as Sunil described it, that, let's put it into just a different analogy, that everybody is playing a note, right? And so, you essentially have your patient there, you have your technology developer there, you have your regulatory individual, you have your funder, and it's actually, Alberta Innovates is helping to kind of convene these conversations, catalyze these conversations, to actually put these notes in order in the right timing, so that you actually have a nice orchestral piece out of it, right? And that essentially is, what Alberta Innovates is doing, is the fact is that, we're listening to what's your challenge, what's going on, who have you engaged, and understanding essentially that client journey and where you are on that client journey, and how can I get you to the next step that again gets you to the end. If we can help you move to the next even one or two steps forward, then we've done well in terms of on your journey. But it starts essentially, as everybody has said here, a conversation. Reach out to us, have a conversation. We may or may not be able to help you within the organization or within our partner, Initech or CFR, but we also have connections outside in terms of with the post-secondaries and other sorts of organizations that may be able to help you. So, it starts essentially with just learn how. You come to the session here and just extend out and give us a call or drop us an email, and we're happy to actually then try to see you along this journey.
And what Tammy just said is exactly how I wanted to end this. You took my exact words. No, that's right. And I would suggest to people that are watching us live, if you have questions, we're going to wrap up right away. But if you have questions, we still check this. We can pull those questions out and follow up with our colleagues online here today and post an answer. I think on behalf of everybody here today, thank you very much, folks, for attending this live session on YouTube. This is great. Team, it was wonderful to hear this, everybody's perspectives on digital health and our shift to that, this global shift to digital health and how it's happening, whether we like it or not.
And also shout out to Miles. He said, extremely well done, Alberta Innovates team. And Sandra is saying happy Digital Health Week as well, everyone. So yes, on that note, thanks everyone. And you can visit albertainnovates.ca.
Thanks, everyone.
Thanks, John. Thanks, Katie.
Everyone.
Thanks,
Thank you.
Have a great day.
See you.